So I was asked to talk about the Farm Foundation meetings that we just recently completed. We had a dozen of these meetings around the country in very exotic places like Albany, New York, and Hansonville, Alabama, Rapid City, Twin Falls. We tried to locate these strategically so that we could reach as many people as possible. And they weren't always the easiest places to get to, but we did have some pretty good attendance. These are the kinds of folks that attended these meetings. We had a lot of feed mill operators that attended the meetings. We had some folks that operated feed stores. We had drug manufacturers, antibiotic manufacturers that attended. Some state regulatory agencies sent people. Our own USDA Veterinary Services sent people to these meetings. We had a lot of extension veterinarians. We had veterinarians from private practice. There were farmers that were invited and farmers that invited specifically to speak and farmers that came, producers. And what was interesting is that we had a lot of people that were what we might term to be hobby farmers, except that they're not really doing it as a hobby. They're just farming minor species. And so they had questions too about how the new changes to implementing the VFD would impact them. The important part of the relationship that we have with USDA and FDA, we've said it here before, is that FDA has implemented some policy changes that will become effective at the end of 2016, January 1. And there have been many of the stakeholders around the country, especially those on the human health side, that have raised the need for metrics to measure the impact of those new changes. And that's part of what FDA and veterinary services are collaborating to do, is to put together a program of surveillance and monitoring to be able to provide that information back to both agencies and to the general public and other stakeholders as well about what that impact is. Of course, it starts with Guidance 209, and I'm not going to spend any time explaining this to you. You know what it is already. It's basically two things: that we would have medically important antibiotics used in animal feed, but not for any other purpose, the only purpose that they would be used for is anything besides growth promotion. I'm sorry I stumbled over that one. But therapeutic uses, basically, that's the word I was looking for, and I couldn't find it in my brain. But therapeutic uses, prevention, control, and treatment. And then that use would be on the order of a veterinarian, and that order would come to the producer by way of a veterinary feed directive. So our role in USDA to do surveillance and data collection and analyze that data is to help define these two terms, stewardship and judicious use. Because, as I said last year, having good public policy depends on having access to complete and correct information. If you don't have that and you're going to put together public policy, then chances are that your guesses may not be right. And we want these to be scientifically based. And so in order to do that, we have to gather the scientific data and, using sound science, analyze that using accepted scientific methodology. And then lastly, we have to have the courage to challenge all of the assumptions that we've had all along with where we're headed, what direction we're headed in. We want to be able to provide value. Specifically, we want to be able to give information back to the production sector that's useful to them so that they can make decisions in terms of how they manage their herd, about whether it's important to vaccinate or medicate, how to manage those animals through the facilities to prevent disease transmission, and lower the need for use of antibiotics if that's possible. And of course, we've got these limitations on resources that are always affecting us in terms of what we can do. And it's very resource intensive to collect that representative data to be able to characterize antibiotic use throughout the industry. The other thing that's important, and I've mentioned this already with the stakeholder community, is to be able to assess the rate of adoption of FDA's changes and what the impact of those changes is really going to be, and then gauge whether the adoption of the new rule in the production sector has resulted in a different way of managing animals and what stewardship means and judicious use. So the FDA does collect some information, the amounts of antibiotics sold from the pharmaceutical companies, and they make that information available to the public. A lot of folks have used that as the gauge, as the measure about use of antibiotics in the animal production sector. but it's limited. It doesn't give us a lot of information on the species that it's used in. It doesn't tell us exactly how much is used at each stage of production. It doesn't really tell us what the dosage levels are at the end of an animal's lifetime, how much antibiotic has really been used in a particular phase or throughout the life of that animal. And it really gives us very limited information about what veterinarians are prescribing it for. We all know that they can only prescribe it in the VFD in terms of what's on the label, but there are different label indications for different species. And in order to know how much is used in each of those labels don't really give us that information. So what we proposed is that we would take the NAMS approach, the National Animal Health Monitoring Systems approach, and that we would continue to do our national studies, but that we would change these a little bit and begin to do them over a period of time that isn't spaced out by 5 to 7 years, rather that we would take the national study approach and do this in a longitudinal manner and monitor the use of antibiotics on particular farms that would volunteer to be in these studies and do it progressively over a period of time, each year, for instance, or every so often in terms of a period of months. The national studies are designed to be representative in the sense that they always seek to target 70% of the operations where 70% of the production capacity in the country is held. And it results in the kinds of studies that you see represented here in this graphic. So some of the things that are characteristic of these commodities studies, I mentioned, because of funding, they've been limited in recent years to being conducted over a period about every 5 to 7 years. When we first started these studies in the major commodities, we were doing them 2 to 3 years apart. They are cross-sectional, so they only look at what's happening on the farm at the time that the survey is administered. And there's a couple of questionnaires that usually go along with the collection of biological samples that are submitted to the laboratory, and that information is provided back to the to the producer that voluntarily participates in the study. It's also collected and brought into a data lab at the Center for Epidemiology, where it's held in confidence away from FOIA requests, and that's done legally under the Confidential Information Protection and Statistical Efficiencies Act. And we can do that and then analyze that data and be able to provide the information back in the form of the reports that I just showed you. These are statistically based, and because they are and because they're representative of the population, we can make inference about the population at large. And that's really the strength of the national studies that we want to capitalize upon when we're talking about doing these in relation to antimicrobial use. There's some limitations of the non-commodity studies. Even if we were to do them more often than 5 to 7 years, they still only provide information in terms of percent of the animals receiving or percent of operations using a specific antibiotic for a specific purpose. It really isn't quantitative in the sense that it would answer the question about the total amount of antibiotic used over the animal's lifetime, but it surely would give us a whole lot more information in terms of a measurable metric that would serve as a benchmark to go forward into the future. These are some of the enhancements that we intend to do with the NAM studies. First, and already, we've begun to analyze the existing data from the previous studies in a different way, different because we analyzed it previously with a view on other things. And what we want to do now is take a look at all of the antimicrobial use data that we collected historically over the last 20 years. And industry has been very helpful to us in providing new data that they have at their disposal so that we can incorporate that into the analysis that we do when we look back retrospectively. We still need national estimates. We need an annual survey, and our intent really is to go into these major industries, the feedlot cattle, broiler, swine, and perhaps turkey to begin with, and then be able to do these studies sequentially over a period of time. And really our goal is to be able to look at specific bacteria, pathogens of interest, commensals of interest, and look for patterns of the emergence of resistance that might be associated with the use of antibiotics on particular premises. This I know is going to be very difficult for you to see, but down the left-hand side, I'm talking about the NAM studies, the national cross-sectional studies is the second row. And all of the surveys that we would do, besides the ones that the Economic Research Service does and others, National Animal Statistics Service, are listed there. And then at the top are the longitudinal studies that I'm talking about that would be done progressively over time with voluntary participation of producers from that other study. And to be able then to take those on-farm studies over a progressive period of time and analyze that data in conjunction with the national estimates would be very useful. There's also an initiative that we're pushing pretty hard to do targeted studies where if we determine that resistant organisms are showing a pattern of detection or emergence from particular samples collected at slaughter, that we would be able to go back to the farm and target some studies and see why antimicrobial resistance is persistent on that particular farm or premises, why it emerged in the first place, what sort of antibiotic usage pattern resulted in that emergence, and if there's a possibility of altering the management structure on that farm, if we can see then resistance regress and go away. And then finally, we are looking to partner with industry in a variety of ways that would help us to bring data that's collected in a sort of integrated production system unit to us so that we could analyze that data and compare the results of that analysis with what we get with the national studies. So there are some major feedlots, for instance, the American Association of Swine Veterinarians with National Pork Board, the poultry organizations that have suggested that, and for that matter, the National Cattlemen's Beef Association also, have all suggested that they might be able to collect data in a useful way, that we could assist with the study design, and that we could collect data, bring it into our data lab, hold it in confidence, analyze that, and provide the information back to them as well as to the rest of the industry in a way that would be useful. A major important part of all of this is, of course, having the diagnostic capacity to be able to detect these organisms and look for resistance patterns. And that really involves our National Veterinary Services Laboratory, the National Animal Health Laboratory Network, laboratories at the Agriculture Research Service, the VetLearn laboratories at FDA, any variety and number of laboratories that are doing tests from slaughter samples with FSIS. And to be able to have these laboratories look at opportunistic samples from clinically ill animals that come into the diagnostic laboratory to seek a diagnosis, to be able to, again, target those studies in a way that we could go out to the farm and collect information about antibiotic usage. We also want to be able to contribute in a way that's consistent internationally with MedVetNet, with PulseNet, with all of the information gathering databases around the globe that are going to be used globally to be able to determine what management practices are effective at controlling resistance in the agriculture sector. So we've been working with NALM, National Animal Health Laboratory Network, to be able to put together some standardized methodologies and to look at also some targeted pathogens that are of interest to the agriculture sector, because the ones that I showed you earlier certainly are important from a food safety perspective, but we expect that there's going to be equal interest from the ag sector about pathogens that affect animal health and whether there's resistance, patterns of resistance showing up there. And so this is an important part of that attempt to monitor that particular aspect of antimicrobial resistance. So how do you measure this? Well, stewardship is a very difficult thing to measure because it's really an ethic that guides behavior toward responsible planning and management of resources. How do you measure an ethic? And of course, ethical considerations in society is what sociologists and other social scientists have been trying to measure for actually eons. And there's a whole different understanding about what stewardship is when it comes to the ecology of antimicrobial resistance, and we have to start looking at some other different terms other than what we're used to as scientists, like the Gaia, the endosymbiotic theory, self-regulating and complex systems, and what autopoeisis means. And we have to put it in some different context, in a sense, than we're used to. All of the research, surveillance, and outreach and education is important, but we need to be able to communicate with other people and other disciplines as well when we start talking about antimicrobial stewardship. Judicious use is a little bit different because judicious use really is a consideration by the veterinarian of those relevant factors that determine the risk, and not just the risk of whether the disease will abate with or without antibiotic use, but whether or not the specific bacteria that's causing that disease can be effectively treated with that antibiotic that we pair up, if you will, with that and administer to the animals in a particular way. Are we getting an adequate dose that's therapeutic? Are we able to do that with the particular antibiotic that's indicated by the laboratory test, for instance, that should be useful? And it's really an important measure that the veterinarian is going to have to weigh every time that they call for antibiotics to be treating in a particular situation. The judicious use measure is listed, the factors are listed here. That evidence of effectiveness that comes from the testing in the laboratory or from a history of testing on the premises that the veterinarian is familiar with. The fact that preventative use needs to be consistent with accepted veterinary practice, and this is one of the really difficult ones to be able to determine because we haven't collected that information in a way that we can give it back to the veterinary profession or to the industry other than what the label indications are. And for preventative use, that's really the only way those drugs can be used. The use is linked to a specific etiologic agent, and we've had discussions in the Farm Foundation meetings. Many people out in the western part of the country raised the issue about whether they would be able to continue to feed tetracycline for pink eye and for foot rot, and our FDA colleagues reminded them that that's not a legal use for that drug already. And yet it's a commonplace practice out there to be able to acquire that drug and use it as a way to treat those diseases in range animals. And so those are going to be some of the challenges for the veterinarian now that's going to write that veterinary feed directive, because before now they were able to go and just buy that, and now there's going to be an intermediary party who's responsible for determining that that use is appropriate. And that appropriate use is going to be targeted to animals at risk, and that there would be no reasonable alternatives that exist, just like it says here. And that's all going to be on the veterinarian that writes that veterinary feed directive. So this is what the FDA has determined the VFD regulation would come back to the veterinarian. It's the idea that the veterinarian may only issue a VFD for use in animals under his or her supervision or oversight in the course of his or her professional practice and in accordance with all applicable veterinary licensing and practice requirements. And that the last part of that sentence, the all applicable veterinary licensing and practice requirements, is really becoming more and more important, because the FDA has said that where there's a veterinary client-patient relationship not defined by the State Practice Act, that their determination of what that amounts to would be what would guide them. There are some states that have a definition of veterinary client-patient relationships, and I'll show you a state at the end of this talk that has already taken action as it relates to the FDA's most recent action for the veterinary feed directive. But this is really going to require that the veterinarian has an integral understanding of what management on the farm is. They're going to have to assume the responsibility for animal care in a more structured way. In fact, the state of California, which is what I'll show you later, actually is requiring that the client also assume that or make a statement that the veterinarian has been given the responsibility for animal care. So that's on the client side rather than the veterinary side. They need to focus appropriately on animal health and welfare and well-being. That's what veterinarians are supposed to do. Every time that you go to the farm as a veterinarian, you ought to be examining the animals, not just the ones that are sick, but all the rest of them that are healthy in the operation as well, so that you know what the health status of the animals are. You need to seek the appropriate diagnosis, do that risk assessment, and make sure that you're using the appropriate antibiotic to treat what it is that you have diagnosed in the herd is causing problems. Not only do you need to do that, but you have to have knowledge now of animal feeding and nutrition and what sort of diet they're on and what the drug interactions might be. If you're going to prescribe a new antibiotic in that farm, you need to know what they've been fed before or what's in the feed now. And so if there's another veterinarian that's been involved in writing a veterinary feed directive on that particular farm, you need to know that history and know that they're doing that, so that when you prescribe one, you're aware of the contradiction in indication perhaps, or whether it's according to the FDA's approvals for the combination of drugs being administered to these animals. So the Veterinary Feed Directive is going to cause greater veterinary oversight on feed use antimicrobials. It's raised concerns about VFD requirements. Some of them are listed here, administrative burden and so forth. We'll get into this a little bit more. This is a slide that shows some studies. The loan repayment program is the one in yellow. The AVMA did a survey. You're not expected to be able to look at these and take anything away from them except that these different colors in these maps. The one at the bottom is our small producer survey that we did in the NOMS unit. The difference in colors in these maps actually indicates areas of the country where there's a shortage of veterinarians to be available to producers to write these veterinary feed directives, and that's going to be a major issue for us. Another part of the equation is the education and outreach that's required, and veterinary education is a part of the outreach effort from the National Veterinary Accreditation Program. We have a module already that's part of the training for veterinary accreditation that talks to judicious use. We've funded changes and upgrades to that module that will be done in this upcoming year with the 2015 budget. And we're working with Jim Roth at Iowa State University to put this together. We have a team already assembled of subject matter experts from FDA and USDA and from industry and academia to put this together, and we hope that we are going to be able to have this available by the time the VFD rule goes into effect for all accredited veterinarians. Another reason why this is really important is because we expect that some veterinarians that have never had farm animal practice as part of their clinical practice will be called upon to write veterinary feed directives, and that's because of the lack of veterinarians in some areas, particularly for exotic species and small animal producers, minor species, if you will, and they're going to more likely call upon veterinarians that are familiar to them, and that's not going to be the livestock production veterinarian. So a small animal veterinarian that isn't familiar with how animals are fed, or that isn't going to that farm once a year or twice a year or every other week is going to be very hard pressed without some knowledge of how to write a VFD and what's all involved in that to be able to do it. And so we're going to put together this module and have that available to all accredited veterinarians. The other thing is that the veterinary accreditation program could represent another data stream, and if we are to provide a blank VFD form on the veterinary accreditation module training program, we could see some consistency in how those are filled out nationally that would be of benefit across state lines. Those are things we could do, not things we've been funded to do. The only thing that we're doing right now is developing the educational module. So these are some slides from Adiana. Kevin Oshner was the host of our meetings over the last 3 months. I thought I'd show these to you, and I didn't see any reason to change them to make them look like I did all the work, because Adiana and Farm Foundation did do the work. And some of the questions that they asked are very interesting. So this graphic shows the participants' role and interest. You can see that 333 people signed up for these meetings ahead of time. They're the ones that filled out the survey. That wasn't the only number of people that showed up at the meetings. There were about twice that many, I think, at the end of the day. They just all didn't register ahead of time and weren't able to complete the survey before the meetings took place. So what I'm showing you here really is information that was gathered before the meetings took place. But you can see that veterinarians made up about a quarter of the number of attendees that signed up ahead of time, the producer about 20%. Other people came. University Extension was greatly represented, government health officials. We had feed suppliers and nutritionists that came. A broad array of people attended these meetings. There was really good participation, if you look at the graph on the right, in the area of interest there from the beef, cow, calf sector. And I found that interesting because I don't think that they're considered to be the heaviest user of antimicrobials, but they were the ones that had the most concern. The preparation and implementation of the VFD from non-producers, what they were doing to be able to prepare. You can see there they were attending meetings. They had looked online. A major source of information was what information they could find online. This was the non-producers part of it here, not the producer part. So these are the people that are actually concerned with providing the information to the producer so that they don't have to explain it every time the producer comes to the feed store or every time they get a feed order. And after the rule goes into effect, there is some concern from the feed suppliers that they'll be getting these phone calls, and all of a sudden producers will hear for the first time that they can't buy feed with a particular antibiotic in it that they have been used to administering to their animals. So this is the producers themselves, the one that attended the meeting, and whether they've implemented changes or not. Only 5% have. They have been 0% that have talked to their feed supplier. They've done some research. 20% of the people did that. About a third of them talked to their veterinarian. 15% have attended meetings. The important thing in terms of talking to the veterinarian really is in establishing that veterinary client-patient relationship. And I think that some of the concern from the beef, cow, calf sector was based upon that, because I didn't see as many of those producers that were at the meetings expressing a sentiment about these changes from the production side, as much as the idea that, you know, I don't have a veterinarian on my place unless I need them there, and only then for a specific reason, and they're really not involved in the management, overall management of my facility or the management decisions. So that might be some big changes for the beef, cow, calf sector. Not so much for the other industries, especially not for the dairy industry. The dairy industry seemed to be the least concerned of all of them, and the most likely to have a veterinary client-patient relationship that was consistent over time. Every other week, pregnancy checks, mastitis, hospitalization of cows for different reasons, and that sort of thing. So this is kind of an interesting graphic here about that relationship. And when you look at the green bars, that's the veterinarian, and you look at the blue bars, that's the producer answering the questions that are at the bottom of each of those. And so the first one there says make all animal health management decisions, and 12% of the veterinarians thought they did that, and only 6% of the producers agreed with them. On the consultative advisor on animal health management graphic, there are 60% of the veterinarians thought that's what they were, that they were consultative advisors, and only 40% of producers thought that. And then when they asked the question about a consultative advisor on a broad range of farm management decisions, the veterinarians, 7% of them thought they were that they were consultative advisors in that regard, but 0% of the producers thought so. And then when you get to the other side of that equation, minor input into animal health decisions, veterinarians said that only 5% of time do I give minor input, and about 3 times that number of producers thought that was the case, that they really weren't following the direction of veterinarians, if you can interpret that way. And then as far as giving strictly clinical advice as needed on an as-needed basis, veterinarians thought, well, only 17% of the time do I do that, which means the other 83% of the time I'm doing more than that. But only 37% of producers thought that that was the case. They thought that most of the time the veterinarian that comes to the farm is doing just that, giving them strictly clinical advice. So veterinarians and the producers have differing opinions, and we really hope that this change in VFD is something that brings those two communities closer together. And remember, this is across the board. This isn't representative of any one industry. Have they had a conversation? Has the veterinarian had a conversation? Yes and no, about an even split when you ask them about whether they've talked about this with their producers. And this is some of the concerns from the livestock industry. You can see here that there's really a bimodal sort of distribution, that about 60% think it would be positive, about 50%, the same number really almost, think it would be negative or slightly negative, positive or slightly positive. And there's different reasons why, and you can see some of the reasons why listed here. That there would be increased dependency on the use of antimicrobials, used a decrease in emphasis on stockmanship, and that with these changes to the VFD, that there will be an increase in stockmanship, stewardship, and management, and that's because they won't be able to rely as heavily on antimicrobials, and they view that as a positive effect. They'll be able to demonstrate to the consumer that they are good stewards, they have better control of antibiotics with veterinary oversight. But then there's the other side of that, on the negative side, that says, well, cattle producers will just switch to an injectable product, or they won't medicate at all, and animals will be sicker, the cost will go up, availability will go down, and animals will die because I can't get an antibiotic to treat them with, I don't have a veterinarian that I can contact. All of these concerns that we've talked about in meetings like this a number of times are real. They're real concerns of producers and veterinarians. So the impact on day-to-day business activities was measured. That was a question that was asked, and the answer is that there's going to be an awful lot of increased documentation, paperwork, some higher cost involved. Producers are recognized that they'll have some decreased access, but most of them don't realize how important it is yet to have a relationship with a veterinarian. That was something that came out in these meetings as well in order to get antibiotics in the feed. And some of them weren't even aware of whether they were feeding antibiotics that would be regulated by the VFD or not. And there was also concern about the decrease in animal health from this new rule and whether that would affect the bottom line in terms of the production costs. There's some of the, this is from the producer perspective. A very large majority of producers thought that it would increase the cost of veterinary care, that they'd have increased paperwork, it would increase cost of production, decrease their access to antibiotics. And then it started to shift into the middle range when they said that there would be an increase in subclinical disease, caused me to make significant management changes. Antibiotics would be used more judiciously. Now we're getting into the negative range. There was a large sentiment on the part of producers that they already don't use antibiotics excessively and that it probably won't change much. And they weren't convinced that all of these changes that are being made to put this under the direction of veterinarians was going to result in any difference in public perception either. They didn't think that it would increase the amount of antibiotics that they would use to treat disease. They, for the most part, didn't think that that it was really a positive thing for them to take those steps in their operations, and they really didn't feel that that there would be any overall decrease on antibiotic use either. For the most part, producers were thinking it really isn't going to change much, except it's going to cause me to have to do more paperwork and pay my veterinarian more, and likewise with the veterinarians. So these are the in terms of the paperwork. And then, so these are some of the implementation of changes impact to the business of non-producers. These are the feed mill operators, the extension agents, and others. And there's going to be definitely a need for more communication and education. All of them agreed, even on this side, especially because they're the ones that have to keep the records for the FDA to inspect, that there would be some increased paperwork. They're going to have to keep the veterinary feed directives for a period of time, as is the veterinarian. I think Craig Lewis will talk a little bit more about that in a minute. There will be an increased demand for veterinary services. Improved public perception may occur. Definitely reduced access to antibiotics, and you can see that the reduced sale of total sale of antibiotics, maybe that would happen, but maybe not. In summary, most of the integrated production systems, milking, dairy, beef producers, and feed manufacturers, they understand the policies, those that came to the meetings. There will be impacts to minor species because they will not be able to buy antibiotics without a VFD, and only then according to the label indications. Veterinarians are concerned about compliance and liability and how to serve their clients, and the measurement of success, as we talked about at the beginning of this talk, is a major issue. Now, this is an example of one state that's responded to the FDA's new rule on the veterinary feed directive. And this is from Annette Jones. Am I over?
Just a little bit, yeah.
Okay. I'm going to go through these pretty quickly. This is the VFD rule, and some of the things here is that medically appropriate and timely visits is there. They're going to have the duration of drug no longer than 1 year. FDA says 6 months. They're going to have willing participants. The authority to receive and request copies of VSDs is vested in the state. They can acquire that information and hold it confidentially, and the state of California can actually share that with other agencies. They're looking at over-the-counter sales. They also regulate over-the-counter sales of injectable antibiotics. Antibiotics will only be available in the state of California to producers by prescription or by VFD. And they can only be used in the judgment of a veterinarian when it's necessary to treat control, or some cases prophylaxis. But the prophylaxis, the prevention part of it, is actually defined now in the California Act here. Most states don't have this definition of preventive use there. So this is my last slide. I actually like always to give a sort of quote at the end and really for me at least, the most important thing is the role that we have in gathering the information, because this is attributed to Mark Twain. It ain't what you don't know that's the problem. It's what you know for sure that just ain't so. And we really need to have the answers to these questions before we put policies in place that aren't particularly appropriate.